talk about setting up capnography, both inline end tidal as well as capnography nasal cannula. So in our airway kit, we carry our capnography nasal cannulas, which are going to be with our right next to our normal nasal cannulas. We also carry them up in the airway compartment on the medic unit. The inline end tidals are typically carried in the back of the monitor. Typically carried in the back pouch of the monitor. So your orange one is adult, and then your yellow one is your pediatric. Okay. These are also carried up in the airway cabinet on the medic unit. I'll just set this down here so it's easier. Okay. When we're setting up capnography for a capnography nasal cannula for a patient, the most important thing to remember is to make sure that we attach the yellow part of the orange part of the capnography cannula into the monitor until this is zeros. So you'll see right now it's a dotted line down on the bottom where it's showing capnography waveform. Once it's a solid line, now we know it's a zeroed. Now we can place the cannula on the patient. This reservoir should face their mouth to catch any residual CO2 exhaled. If you are just monitoring CO2 and not administering oxygen, you do not need to untie the green part. And these will also go, we can administer 2 to 6 liters per minute. It's important to remember in our cardiac arrest scenarios, we do not use the capnography cannula to administer high flow oxygen initially. We can only do that with our regular nasal cannula. If we have an intubated patient or a patient we are assisting ventilations with the BVM and we are using the inline end tidal, same thing, try and zero it. And it just attaches to the bottom of the bag. A lot of times it's easier to attach this before you are ventilating a patient so you don't have any breaks in ventilating. So attach this and then you can attach it to your ET tube. And then if you do have an intubated patient, you will see the big number is your exhaled CO2, and over here where it says RR, that's your respiratory rate. So you can monitor how quickly you are ventilating an intubated patient, and it's important to remember we don't want to ventilate too quickly.